seat on the table. What is your name and date of birth?
My name is Addison Brown. I was born 2/6/95.
Nice to meet you, Addison. My name is Payton Brown, and I'm a student nurse practitioner here at NKU, and I will be performing an assessment on your head, eyes, ears, mouth, and throat. Are you okay with proceeding?
Yes.
Great. I'm going to perform some hand hygiene, and then we'll get started with your exam. So what brings you in today?
I've been experiencing a headache recently, as well as itchy eyes. My nose has been running, and I've had a really sore throat as well.
So how long has this been going on?
Probably the last 3 days.
Has this happened before, the same symptoms?
Yes, it seems to be happening around the same time of the year.
Okay, any problem swallowing or shortness of breath?
No.
Okay, and your nasal drainage, what color is that?
It's been clear.
Okay, and where exactly is your headache?
It's towards the front here.
Okay, any ear pain or drainage coming from there?
No.
Okay, all right, we will get started with some vital signs now. And while I get your vital signs, I'm going to state on your general appearance. So as you walked in the door, your gait and mobility were very good, sturdy and strong. You're well nourished. I'm going to take this off of your temperature. You're well nourished. You're a young man in no acute distress. You appear your stated age. Your posture is upright and looks good. And like I said, your gait and mobility were strong and even. So your overall general health is very good. All right, your oxygen is 99% on room air. Your blood pressure was 121/80. Your heart rate was 60. Your respirations were 16. And your temperature is 97.5. All of that is normal. Now we're going to go ahead and look at your skin here. Okay, your skin is appropriate for your ethnicity. I don't see any bruising or ecchymosis or erythema. I'm going to check on your skin turgor, and all of that is good. No tinting, no signs of dehydration. Any tenderness when I palpate it?
No.
Perfect, okay. So your skin looks very good. Now I'm going to check on your head here. I'm going to feel around. There's no indentations, any tenderness?
No.
Okay, no tenderness noted. Your hair is evenly distributed. On inspection here, your head is normal cephalic, shape is round, there's no extra movements going on, so your overall head inspection looks good too. Now I'm going to go ahead and test your TMJ. So go ahead and open and close your mouth for me. Any tenderness?
No.
Okay, good. No tenderness or crepitus noted on your TMJ. Now I'm going to externally look at your facial features. So your eyes here, the iris looks good color. Eyelashes are intact. Eyebrows are also intact. Eyelids look good, symmetrical, no ptosis or ophthalmos noted. On your nose, there's no septal deviations. It's symmetrical, looks good, clearly patent. And your ears here, they both look symmetrical, good color, no sun damage noted. Any tenderness when I touch here or here?
Nope.
Okay, they're both round, helix is round, auricles look good, no obvious drainage coming out of those. Now the outside of your mouth, it looks symmetrical, no drooping. The lips look pink and healthy. Now I'm going to take a closer look in your mouth. Go ahead and say ah for me. Okay, very good. The oral mucosa is pink and moist. The teeth are white. I don't see any signs of dental caries or missing teeth, which is good. The tongue is a nice color pink, no white coating or lesions noted. The uvula rose, which is good when you did that. It is slightly swollen and red. Also, your pharynx is red with cobblestone appearance, which is normal for post-nasal drip, which is what you're experiencing. All right, now I'm going to look a little closer into your eyes here. Just go ahead and look straight ahead for me. Okay, good. The optic sticks is intact. The margin, there's no blurriness in the margins, and the vasculature looks good, and the sclera is white. Alright, and this one, pupils are reactive, iris looks good, sclera is white, optics disc is intact, no blurriness of margins, and the vasculature looks good in there as well. Now I'm going to look at your conjunctiva. I'm just going to pull down here. That's pink and moist. I'm going to pull up there. Pink and moist, no signs of lesions or masses on that, so that is normal. Now I'm going to go ahead and look a little closer in your ears. Alright, the tympanic membrane is pearly gray, appropriate size and shape. The canal is patent, little earwax, no signs of drainage or infection, which is normal. Now we'll come to this side. Alright, tympanic membrane is pearly gray, good shape, size as well. No signs of infection or drainage. Canal is patent. So that looks good. Now I'm going to change out speculum. And then we will look at your nose. Alright, no septal deviation noted. Speculum is intact. The turbinates are slightly pale and boggy, which is normal for your symptoms. Otherwise, the other tissue looks pink and moist and intact. Now I'm going to do your visual acuity. So I'm going to put this 14 inches away. Alright, with both eyes, go ahead and read the smallest line for me.
LTFPH.
Okay, and then with your hand, cover your right eye.
LTFPH.
Okay, and then cover your left eye.
LTFPH.
Okay, so in both eyes, your vision was 20/20, and then in the right and left, your vision was also 20/20, which is perfect. Now I'm going to test your peripheral vision field. So once you see my fingers, go ahead and say now.
Now. Now. Now.
Good.
Now. Now. Now.
Alright, peripheral vision fields are intact. Very good. Now I'm going to test your extraocular movement. So go ahead and follow my pin light with only your eyes. Very good. Extraocular movements are intact because there was no shakiness or nystagmus, and smooth movement, so that's great. Now I'm going to go ahead and test your hearing a little bit better. So I'm going to whisper 3 things behind you, and I want you to verbalize what they are, okay?
Cat, dog, mouse.
Okay, we'll do the same thing on this side. That was correct.
Cat, dog, mouse.
Okay, whisper test is normal. He was able to verbalize. Now we are going to do the Weber test. So I'm going to hit this and put it in the middle of your head and tell me if you hear equal vibrations, okay?
Yes.
Okay, good. Now we're going to move on to the Rhine test. So I'm going to hit this and then let me know when this sound disappears, okay?
Now.
Okay, same thing. Let me know when it disappears.
Now.
Okay, we'll do it on this side.
Now.
Okay.
Now.
Alright, and that was normal because it took twice as long for the sound to disappear in the front of the ear, which is expected, so that's very good. Now I'm going to go ahead and palpate your nasal sinuses, so let me know if you have any tenderness. This is the frontal sinus. Any tenderness?
No.
Okay, now we're going to check on the ethmoid sinus. Any tenderness?
No.
And now the maxillary sinus.
No.
Okay, now we're going to test the lymph nodes, so can you go ahead and unbutton that for me? Alright, so we're going to look at the preocular. Let me know if at any point you have tenderness, okay?
Okay.
Postocular, tonsillar, occipital, superficial, submental, submandibular, anterior cervical, posterior cervical, deep cervical, and then the superficial clavicular. Any tenderness in any of those?
No.
Okay, so no hard nodules, they're freely movable, and no tenderness, which is normal and expected. That's very good. So that really concludes our exam today. Do you have any questions for me?
No, I do not.
Okay, so overall, I think what you're experiencing is seasonal allergic rhinitis, which is allergies. I have a few recommendations for you. I recommend that you wash your linens once a week with hot water. I recommend you take an over-the-counter Zyrtec to help with those symptoms. And I also recommend that you check the pollen count, and if it's elevated, you wear some glasses and a rimmed hat to help prevent the pollen from getting in.
Okay.
Any other concerns or questions for me?
No, thank you.
Well, thank you so much for letting me do your exam. Okay, you're free to leave, and I'll perform some hand hygiene.